We're about to actually talk about a whole lot of congenital heart diseases. I know that these congenital heart diseases, they affect what? How blood is being circulated in the fetus. Do you understand? How blood is going around, how much of the blood the baby is receiving, and all of that. These congenital heart issues affect it. So we just want to say that before we start talking about disease condition, at least we should refresh our knowledge of embryology. So part of the things we are trying to refresh is to still talk about the blood circulation in a fetus. Blood circulation in a fetus. Okay, so this is just a diagrammatic representation, and you can see that what the placenta is there, the umbilical vein is there, umbilical arteries are there, ductus venosus, Foramen Ovale, Ductus arteriosus, and all of that. Do you understand? All these things will undergo a lot of changes when the baby is born. You get. So just a reminder or a refresher. Fetal circulation, just so you know, is a beautiful adapted system. It's adapted because the baby is inside the uterus. So you have a system that is now compatible to that that type of environment. Do you understand? So it allows the fetus to receive oxygen and nutrient from the mother. All right, and the baby has not started putting its own lungs into use yet. You understand? So the lungs are not functional until they give birth to the baby. That first cry is what usually kicks the lungs into functioning. So key features of fetal circulation is placenta as a lifeline. Okay, so the placenta acts as a lungs, acts as a liver, acts as a kidney. So the baby is receiving oxygen, the baby is filtering out waste. Everything is through the placenta. All right, this placenta. So oxygen and nutrient from the mother's blood is what is crossing into the baby, okay, via the placenta. Okay, so umbilical cord vessels. The umbilical vein carries oxygen-rich blood from placenta to the fetus. Umbilical arteries, there are about two. There are two of them. You can spot it out. That one, it returns the deoxygenated blood and waste from the fetus to the placenta. So unlike in the adults where the veins are carrying the deoxygenated blood, in fetus the veins are carrying oxygenated one. Arteries are carrying vice versa. Are you getting the thing? So this is another very good image showing all the blood vessels and all. So circulatory pathway is highlight. Then ductus venosus. It shunts oxygenated blood from the umbilical vein directly into the inferior vena cava, bypassing the liver. So this is ductus venosus. Do you understand? So it shunts it. So blood doesn't have to go, into the liver before it gets anywhere. Okay, bypass the liver. Foramen Ovale. This is what the foramen ovale. I can see that blood can follow here directly. Okay, into that should be aorta, right? So it said that this is a hole between the right and left atria of the heart. It allows blood to skip the lungs and go straight to the right atrium. Then from the right atrium to the left atrium. Then ductus arteriosus. This is it up here. Okay, it's kind of like blood is moving from the pulmonary trunk into the aorta from there. Okay, so connects the pulmonary artery to the aorta, diverting blood away from the lungs into systemic circulation. So blood doesn't have to go to the lungs for oxygenation, it just goes directly into systemic circulation. So why this matters is this shunt, they ensure that most oxygen rich blood reaches vital organs like the brain and heart. And because your lungs is not yet functioning yet, you don't really need your lungs for anything. You understand? So after birth, these shunts, they close as the lungs takes over oxygenation. This will now transit the baby to the normal postnatal circulation. Okay, so that's it for a summary of the blood circulation in a fetus.